Over 740,000 individuals are affected with a stroke each year in the United States. Over 130,000 of those individuals will die. Almost every 4 minutes, an individual in the United States has a stroke. I'm an individual that had a stroke in December of 2016 on the 23rd. It is now almost 40 days later, January 27th, and I'm in the recovery part. And recovery, as every individual that has had a stroke knows, that can be the toughest part. One of the simplest things that is available is acupuncture. And acupuncture can be one that helps the individual come back from the stroke. Thank you for watching and understand a little bit.
Hello, my name is Bethany Bechtel, and I'm an acupuncturist in Gainesville, Florida. I'm working here with Don on some aphasia that he's experiencing following an ischemic stroke that he had a little over a month ago. And he's making excellent progress. When I first saw him a couple days following the stroke in the hospital, he was having trouble getting any words out, and now he's actually teaching classes. So what we're doing here is a combination of things. I'm doing some traditional body points that are from the traditional Chinese medicine that's several thousand years old. And I'm also using some more recently developed scalp points that follow the neuroanatomy of the cerebral cortex. So we're kneeling over the areas for aphasia, the motor area, nominal aphasia in the back, and the cerebellum at the back of the head. Also, I've studied with Dr. Kathleen Levy, who's also an acupuncturist in Gainesville, and she has studied with Dr. Lin. So we're following that system of acupuncture for the scalp points.
Scalp acupuncture was developed about 60 years ago in China. So they've been researching it for about that long. There's quite a few different styles. The style I practice was developed by a neurologist, and she used brain maps, the same as our Western physicians are familiar with, to develop areas of the scalp to needle to treat corresponding brain injuries. There's 4 cortices. They run this way on the scalp. I usually measure them with my hands to determine where I'm at. The needles are inserted along the cortexes to stimulate blood flow to those areas of the brain which were damaged. We can treat spasms and tremors. We can treat flaccid paralysis. We can treat painful or numbness conditions. We can also improve blood flow to areas of the body using these cortices. One of the things we found is that if a person is very depressed after a stroke, they often don't have the ability to build new blood cells, new brain cells. The brain cells would go to the areas where injury had been and lay themselves down due to improved blood flow. So frequently we have to treat depression before we start to get results with scalp acupuncture. Some of the areas that we use to treat depression are also on the scalp to improve blood flow to the brain. Sometimes antidepressants are helpful in the use of stroke rehabilitation. Other areas that we frequently use during the scalp acupuncture to treat conditions, let's say, associated with the visual cortex would be in the back of the head here. We can treat areas associated with balance and coordination with the cerebellar area. We can treat areas on the side of the head here when the ears are involved or balance has been affected. Some of these areas can be used for degenerative conditions as well as brain injuries and strokes. The whole front part of the head here is associated with a series of points that are used to treat conditions involving the upper part of the body, middle part of the body, or lower part of the body. The Broca area is over here, and this area is also associated with the motor cortex, which improves the ability of a patient after a stroke to use their mouth, their vocal cords, and their tongue to pronounce things appropriately. We have an area right here called apraxia, if somebody has lost fine motor control over their affected hand. There's also an area up here that we use for nominal aphasia, or the inability to remember the names of things or people. scalp acupuncture is an extremely effective technique that works better within the first 6 months after a brain injury. And it also works better if the injury was on the surface of the brain rather than deep internal areas. And we'll frequently use body parts like the arm or the leg that's been affected to help stimulate the muscles to be able to gain strength and coordination. Scalp acupuncture is still being developed as we speak. They've developed areas for recalcitrant, difficult to treat insomnia, the forgetting of mathematical symbols, and we can also help people differentiate between different kinds of sounds, like the difference between sounds, like bird singing versus speech. We can help them to remember the storyline that they're trying to recall.